Good afternoon. Thank you all for joining us again for Heart Gallery's monthly webinar, Texas Medicaid Essentials for Foster and Adoptive Families. We are so thankful that you could join us today. And we're very excited to have with us Sarah Sanchez. She's one of the regional managers at Maximus, and she covers the Houston area. So for today, we're gonna listen to Sarah's presentation, and then after that, we're gonna go ahead and have a time for some Q&A at the end. So if you have any questions, please feel free to write them in the chat as I'll be monitoring, or you can wait to ask them to the end directly. But again, so go ahead and feel free to use the chat just if you have any questions that they come up. And then at the end, we'll go ahead and have a small Q&A with Sarah. But for now, please help me. And then also I'll be following up with everyone after the training through email. And that will include some resources as well as Sarah's information, and then some of our trainings that are coming up too in the future. So again, you'll receive that at the end. But thank you all so much for being here today, and please help me welcome Sarah. But go ahead, Sarah. Thank you.
Thank you. Good afternoon, everyone. Hopefully everybody is staying dry. I know that we've had a lot of rain across the state. So thank you. Thank you so much for having me. Like Cassandra mentioned, my name is Sarah Sanchez Pequeño, and I'm one of the regional managers with Maximus. We are the enrollment broker for the state Medicaid program, along with the Texas Health Steps Outreach and Informing. So today I am going to be providing a presentation on an overview of Texas Health Steps for foster care. So we're going to go ahead and get started with today's presentation. So some of the training objectives that I have for today is to familiarize participants with the Texas Health Steps program, to help you become familiar with Texas Health Steps benefits and services, to become familiar with how to use these Medicaid benefits, and to know the function and responsibilities of the Texas Health Steps outreach and informing staff. We also want to ensure that all children in the custody of DFPS get their first Texas Health Steps medical checkup within 30 days. Not only is it very, very important to ensure that children in custody receive those Texas Health Steps medical checkups on time, but it's good for kids and it helps with planning for appropriate services for that preventative care, which is very important. This is also a policy and a contractual requirement for residential providers, and we are hoping hand in hand to help DFPS with those efforts to improve the compliance of those Texas Health Steps checkups. Oh, I skipped a slide, I'm sorry. So the purpose of our outreach and informing staff is to educate, urge, and help. So we want to make sure that we are educating all Medicaid clients about benefits of preventative care. Like I mentioned, that preventative health care, which is very important for our children. We want to make sure that we urge Medicaid clients to participate in Texas Health Steps benefits and services. We want to help Medicaid clients to use these services and overcoming any barriers to participation. Some of the barriers that we commonly see across the state are language barriers, transportation barriers, finding providers. So we do we do ensure that Medicaid clients do receive proper certification for Medicaid. They receive Texas Health Steps information. These are sent out by the certifying agency, and they're sent out either by mail, in person, over the phone. Medicaid clients can also access these services, this information online as well. So our Texas Health Steps outreach and informing enrollment broker responsibilities. This is our staff. This is our Maximus enrollment broker staff and Texas Health Steps outreach and informing staff. We operate the Texas Health Steps toll-free line. We also provide Texas Health Steps outreach and informing to all targeted populations. We educate, inform, and collaborate with community partners regarding the Texas Health Steps. We also fix problems and issues regarding access to care, like some of those barriers that I was talking about previously. And we make appropriate referrals as necessary as well. So our enrollment brokers also complete phone calls. We perform home visits upon request. We provide healthcare orientations on Texas Health Steps. We refer to Superior Health Plan Network for help scheduling visits or locating providers. We also provide information about medical transportation services and how to schedule rides. We complete case management referrals and referrals to other agencies as well. Our outreach counselors out in the community also conduct a lot of community involvement through participation in interagency meetings, with foster care association meetings. We're out at health fairs and presentations. We do presentations at schools, at Head Start programs, and other community agencies. We're out there having lots of fun with the population and just providing all these resources and great Texas Health Steps education to families. We perform targeted outreach to families needing a healthcare orientation, needing foster care, children, SSI, children leaving the DFPS conservatorship, pregnant teens or parenting teens, migrants, and other groups. So those are the populations that we are targeting out in the community. Eligibility for Medicaid services. The Texas Health Steps services are available to all Medicaid recipients birthed through the age of 20. Texas Health Steps provides outreach and informing services to all eligible participants. So our outreach staff do receive weekly lists of any newly approved recipients, and all clients receiving full Medicaid benefits through the age of 20 are eligible for these Texas Health Steps services. Now, the Texas Health Steps medical checkups, that's one of the requirements that the state has for a child on Medicaid to receive the Texas Health Steps medical checkup, which is one of them. So the checkups are needed according to the Texas Health Steps periodicity schedule. There are special rules for children in the DFPS conservatorship. The medical checkups must take place within 30 days of coming into DFPS conservatorship. This does include newborns. So the newborns typically have to go in at 5 days, 2 weeks, but I'll get into it a little bit further in the next few slides to let you know about that schedule. So the first Texas Health Steps medical checkup. Children who are in foster care must get the first Texas Health Steps medical checkup within 30 days of coming into DFPS conservatorship, like I was mentioning before. And the first Texas Health Steps medical checkup is one of the tools that's included in 3 in 30. You're going to hear 3 in 30 mentioned here throughout the next couple of slides. And at the end of this presentation, as Cassandra was mentioning, she's going to be sending out an email with some follow-up resources. I will also include that 3 in 30 flyer so that you can have access to it and just read up a little bit more about what I'm going to cover today. So your 3 in 30 is a comprehensive approach to better care for children. It includes 3 separate visits that are needed in the first 30 days of a child coming into the conservatorship to assess what is medical, behavioral, and developmental strengths and the needs of children and youth entering conservatorship of DFPS. So this tool of 30 in 30 includes the 3-day medical exam, which this must be within 3 business days of the child coming into custody. It is needed for all children and youth to check for any injuries or illnesses and to get any necessary treatment early on. This is a separate visit from the Texas Health Steps medical checkup. Like I mentioned before, there's 3 of them. The 3-day medical exam is the one that we just covered. And then we have the first Texas Health Steps medical checkup. This is to be completed within 30 days of removal and is also needed for all children and youth that come into care. This checkup provides a comprehensive head-to-toe checkup for medical issues to be found and treat any problems early and assure that the child is growing and developing as expected. And then finally, in the 3 in 30 tool, we have what's called the CANS assessment. This assessment is to be completed within 30 days of removal for children who are 3 years of age or older. So this applies for children between the ages of 3 and 17. This is to provide a comprehensive trauma-informed behavioral health evaluation. I do want to stress that it is very important for these visits that are included in the 3 and 30 tool to be completed. And it's also important to stress that they are 3 different visits and one cannot substitute the other. So most importantly, we want to stress that the 3-day medical exam does not take place of the first Texas Health Steps medical checkup that's needed within 30 days. Today, in the coming up slides, we will be going over and only talking about and focusing on one of the tools or the visits that are included in 3 and 30, and that's going to be the first Texas Health Steps medical checkup. We will discuss some of the services included in the Texas Health Steps program. Like I mentioned early on, this is going to focus on a Texas Health Steps overview, so that's what we are going to be discussing today. Now, I do know that there could potentially be a lot of questions, right, about the 3-day medical exam, about the CAMS assessment that we just covered a little bit about right now. But we have been instructed by DFPS that they do have a mailbox where you can definitely send your questions about any follow-up questions that you may have on the 3-day medical exam or the other 2 visits included in the 3 and 30 approach to serving children. The mailbox is on your screen. Excuse me. The mailbox is on your screen and will be monitored by the medical services team in the state office at CPS and or DFPS. So you can also contact your regional well-being specialist for help with questions about any of the services included in the 3 and 30 approach. The link is also on your screen, and this provides names and contact information for the regional well-being specialist if you need to look that up. I will also make sure that Cassandra has this information, these websites, so that she can share them with you in that follow-up email so you can make sure that you have access to that. So ongoing Texas Health Steps medical checkups. This is for children younger than 3 years of age receiving checkups at more frequent intervals. Like I was mentioning before, excuse me, children at the newborn stage do need to receive that first Texas Health Steps checkup, then at discharge to 5 days, then at 2 weeks of age. Then you have the 2, 4, 6, 9, 12, 15, and 18 months of age, then at 2 and 2.5 years of age. And then children who are aged 3 to 20 years, those must receive a yearly medical checkup. They spread them out a little bit more when they turn 3. So the expectations to your periodicity schedule. Children might have exceptions to the periodicity medical checkups when it's medically necessary for any developmental delay or suspected abuse. For example, if there's an environmental high risk, if one of the siblings of a child with elevated blood lead levels, that is when it's medically necessary, or when moving from one DFPS placement to another, right, which happens a lot more often. So that's when those are medically necessary and needed to meet those state or federal requirements for Head Start, daycare, foster care, or any pre-adoption. Also needed for dental services provided under dental anesthesia as well. That's when those exceptions might come across. We tell all parents what to expect during a medical checkup. So medical checkup components are very, very important as a parent to know what to expect and be prepared for that thorough examination instead of being confused of what is a Texas Health Steps checkup, or if I might be taking my child in for a regular acute care visit. We want to make sure that as parents, everybody is aware on how to differentiate those two. So during a medical checkup component, we educate our parents to ensure that they know that when they're taking the child in for a Texas Health Steps checkup, they do expect what's a health and developmental history screening, which may include nutritional, developmental, autism, mental health, and even a tuberculosis screening might take place during these checkups. We also let parents know that it is okay if the doctor asks to remove your baby's clothes. There is an unclothed physical examination that may take place as well. And this physical examination could also include taking the child's measurements, an oral assessment, a vision and hearing screening. There could also be labs that are done during that Texas Health Steps checkup, any immunizations that the child has that are required, dental referral beginning at 6 months of age, or any other referrals to other service providers that the doctor might need to refer out as well. Now, with all that being said, on the medical side, there's also a dental checkup component that should also be met under Texas Health Steps. So the first dental checkup, sometimes I get from parents, well, my child doesn't even have teeth yet. Why am I going to take them to the dentist at 6 months of age? Well, it's very important because that's when our kids start getting accustomed to, let's go to the dentist every 6 months, right? So children age 6 months and over need to have a dental checkup within 60 days of entering DFPS conservatorship. For children already in foster care, those dental checkups must be completed within 30 days of the child turning 6 months of age, and then 6 months thereafter. Those continue every 6 months. So those ongoing dental checkups, 6 months through the age of 20, are due every 6 months. From 6 months through the 35 months of age, who have a high risk of caries or tooth decay may receive checkups at 3-month intervals. This is always going to be determined by the dentist. It's not something that as parents we can request. The Texas Health Steps requirement is only every 6 months, but the dentist must make that determination. If it's needed more often, it would be every 3 months. So some of the dental services that as a parent, we need to expect to receive during these dental services, the dental checkup of Texas Health Steps, just like I mentioned, there's medical needs, right? So now we're going into the dental services, and some of those services will include cleaning, examination, sealants, oral health education, follow-up services as necessary. Braces are now medically necessary. In the past, Medicaid would approve left and right, those braces. Unfortunately, it's not the case anymore. The braces have to be medically necessary. Emergency services are also available at any time and no referral is needed for those. Preventative services, and those come with those checkups that we want to be taking our kids to the doctor to the dentist, every 6 months for those preventative care checkups. Any therapeutic services, diagnostic services, anticipatory guidance or oral health education, any referral to dental specialist or ortho needed, those will come from your regular dentist checkups every 6 months. Now, moving away from the medical and the dental components of what to expect during the Texas Health Steps checkups, Texas Health Steps also offers non-emergency medical transportation services. These are available to all Medicaid recipients. These services include rides to the doctor's office, the dentist office, the hospital, drugstore, or any place that provides covered health care services. Medical transportation can offer the following services to Medicaid clients. They can offer arranging a free ride by a transportation service contractor. They can provide free tickets for route transportation. They also provide reimbursement for mileage if you drive yourself to the doctor's appointment. They can also arrange airline transportation if that's something that's needed. Now, Medicaid recipients currently enrolled already in a managed care plan, we would refer those recipients to your medical plan to schedule any medical transportation services that are needed. Those would be for medical and dental visits. Recipients should call the number on the back of your member ID card, which is your plan, pertaining to your plan, to schedule those rides needed or that transportation need. Now, if you are a recipient who is currently not enrolled in managed care, then that means that you have something called traditional Medicaid. Traditional Medicaid recipients need to call our MedTrip services at 1-877-MedTrip, or the number is on the screen, 1-877-633-8747. MedTrip services are available Monday through Friday from 8 a.m. to 5 p.m. Central Standard Time. And they are available to schedule medical transportation services for medical and dental visits. Now, for our foster care population clients, medical transportation services are also available, and those would go directly through your superior plan. So on your superior card, on the back of your card, there is that number where you would call to schedule those transportation services. I just want to throw out there as well, because this is a question that comes up a lot. I do want to indicate that any child that is younger than 14 years of age may not travel alone without a parent or a guardian. Children between the ages of 15 and 17 may travel without a parent, but the parent must provide written permission before the trip is scheduled. Okay, I just wanted to throw that out there because that question does come up quite often. Now, with the non-emergency medical transportation, I do want to add that recipients must have no other means of transportation. They need to identify any special needs when the transportation services do happen. They want to provide all facts about the healthcare services that they are to receive. You want to make sure that you call 2 to 5 days ahead of your scheduled visit to set up that transportation service. Recipients may be able to be approved for scheduling an appointment with less than a 48-hour notice, only in the exception if the doctor or dentist must see them for an urgent condition, if they are released from a hospital, clinic, or any other healthcare facility, or if they need a ride to the drugstore. That's when those exceptions do happen, that they allow for you less than a 48-hour notice. Now, it is very important with this non-emergency medical transportation service, when requesting a ride, we need to make sure that we have the following information when calling to schedule that ride. We want to make sure that we have our Medicaid ID number available, our Social Security number for the person with the appointment. We want to make sure that we have the name of the medical professional that you or your child will be seeing. You want to have the address and phone number of your appointment location, the address of phone number of your pickup location. You want to provide the reason for the visit, the date and time of the appointment. You also want to let them know when you're calling to schedule this transportation service, if you or your child have any unique needs, including, for example, if you need a wheelchair, if you need a lift or a walker. We want to make sure that you are receiving the transportation services to your needs, to tailor to your needs. So we want to make sure that the right vehicle is sent for whatever tailored we need to do for your needs. Now, moving on to the service delivery model for foster care and Star Health. I'm going to talk a little bit now about what the Star Health program is. All services are provided through your Superior Health Plan network. Services include your medical, dental, vision, and behavioral health, as well as drugstore services. All Medicaid cover healthcare services with the added benefits of service coordination and clinical service management staff to manage the healthcare of children with special healthcare needs. The Star Health benefits chart is a very, very nice chart to have whenever we're trying to figure out what services come with Star Health. So all of these services on here, again, do not replace that Texas Health Steps checkup. That 3-day medical exam does not take place of the Texas Health Steps checkup. This is all in addition to that checkup that needs to be done within the first 30 days. So the Texas Health Steps medical checkup, as I mentioned previously, is for children under the age of 21 who are generally provided by your child's primary care provider. If the child's primary care provider does not provide Texas Health Steps checkups, as a parent, you want to make sure to call your Superior Health Plan network to get those services and to make sure that you have a provider who does the Texas Health Steps checkups. We talked about the Texas Health Steps dental checkups. Those, again, are for children under the age of 21 and must start at 6 months of age and thereafter every 6 months. You also get vision exams as well. Those vision tests are for glasses and or contact lenses. You have your behavioral health services, and this includes inpatient and outpatient mental health services, including psychiatric services, outpatient and residential substance use disorder treatment services, mental health targeted case management, and rehab services as well. Then you have your emergency care services. In any emergency situation, of course, call 911 if it's a true emergency. And then for any basic medical services, you want to contact the primary care provider. We talked about the CANS assessment. That CANS assessment is the Child and Adolescent Needs and Strengths Assessment. This is a comprehensive trauma-informed behavioral health assessment for children and youth from age 3 to 17. The CANS assessments are provided by Star Health credentialed CANS approved providers. And then you have that 3-day medical exam, as we also touched base on early on in the slides. This is for all children entering the care of DFPS and must be seen by a doctor within those 3 business days to be checked for any injuries or illness and get that treatment as needed right away. You also have a service coordination service. This is for help finding doctors, dentists, nurses, and clinics, or scheduling any visits. You have your service management also available, and this is for help managing the healthcare of those with ongoing serious medical needs, developing treatment plans, monitoring treatment progress as well. And then you have prescription services. The health plan can help with problems getting prescriptions filled, or if more facts are needed about the prescription, that's when you would reach out to your superior health plan. The primary care provider changes, if there are any changes that need to be made to the child's primary care provider, that's also a service available. And the child's medical consenter needs to call Superior Health Plan Network to make those changes to the primary care provider. You are not locked into one provider. You can make those changes just by calling the Superior Health Plan Network. And then the Star Health benefit also has a 24-hour nurse helpline. Superior Health Plan Network nurses are available to answer healthcare questions at any time, 24 hours a day, 7 days a week. And you all can call 1-866-912-6283 as the number on the screen for that 24-hour nurse helpline. We talked about service management in the previous slide, right, in the chart. So just to add some of the things as far as to what come with your Star Health benefits, Star Health Service Management Program provides any support services that manage all medical and behavioral health care needs for Star Health members. Service management is seen as the heart of Star Health program. It's comprised of integrated teams from both the physical and behavioral health sides, and they can help with many areas, such as finding doctors or specialists, helping with scheduling visits, providing education on health concerns or diagnosis, completing a healthcare service plan, following your child's progress, participating in hospitalization and discharge planning, and providing health information as needed. That's what your service management or service manager is there available for you. Now, there is a different program called case management for children and pregnant women. Most children in the conservatorship of DFPS join Star Health program. That chart that we just covered, that's all the services through Star Health, right? But through Star Health Service Management, they have staff available to identify and coordinate access to all available physical and behavioral health services, as we discussed. But a caseworker, caregiver, residential provider, or primary care provider can also ask a member to receive help and be assigned a service manager at any time. Now, there are often times when Star Health service management staff will refer for case management service needs beyond the capacity of Star Health. And that's where they contact the case management for children and pregnant women, which a case management service with a service, there are licensed social workers or registered nurses who do help children or women who are pregnant and their families in getting help with using necessary medical or dental services, also any educational issues, locating resources, other necessary services that Star Health Management might not be able to assist with. That's where case management comes in. So in order to be eligible for case management, these are for children and pregnant women, and the recipient must be able to get Medicaid. They must be a child birth to the age of 20 with a health condition or health risk, or a high risk pregnant women of any age. They, to be eligible, they also need help in gaining access to necessary medical, social, educational, and other services related to the health condition, the health risk, or the high risk condition. And they have case management service needs beyond the capacity of Star Health, as I indicated, or simply they have the desire for case management. If they stress that desire, that's when they can become eligible for case management. We are now going to move on into the foster child transition to adoption assistance or permanency care assistance. So the adoption assistance and permanency care assistance programs are operated by DFPS, and these provide help to children exiting the foster care system and or entering permanent placements. Adoption assistance is for families adopting certain children from foster care. For example, in these situations, could include children adopted to join a sibling, children with disabilities, and a child maybe from a minority group that traditionally faces barriers to adoption. And then you also have your permanency care. This is for families that provide a permanent home for children in foster care who can't be reunited with their parents. This program provides support for children who are managing conservatorship of kinship providers, for example, grandparents, or they might be with an aunt or uncle as well. So how does the enrollment process start, right? There's this enrollment process that needs to be done to come into managed care, to Medicaid managed care. Well, what happens with this process is that each Medicaid client will receive an enrollment kit by mail. This enrollment kit, you have a little picture of a sample of those enrollment kits that are sent by mail to the recipients. That's what you see on your screen. And that kit is going to be sent to the client the day following the enrollment broker's notice of the recipient certification for Medicaid. In that kit, you will receive a welcome letter. You will receive brochures on Texas Health Steps. You will receive an enrollment form. You will receive a special healthcare needs flyer, a comparison chart to talk to you about the different Medicaid managed care plans in your area. You will receive a managed care report card as well for the STAR program. You will receive a provider directory if you're being certified for STAR Kids, a postage paid reply envelope as well to make your selection. I just want to go back really quick just to let you know that the selections can also be made by calling our STAR program helpline, which is our 1-800 number. And that number is 1-800-964-2777. And I am going to include in the resource guide that Cassandra is going to send you at the end after our presentation, I'm going to include that STAR number as well so that you can have that handy. Because not only can you send back the postage paid reply envelope with your selection, but you can also call a 1-800 number, and our enrollment brokers are ready to help you there as well. Now we're going to move into former foster care children. Our former foster care children will keep getting Medicaid if they meet all of the following conditions. If they have aged out of foster care in the Texas Health and Human Services at age 18 or older, from 18 up to the age of 26 years of age, received federally funded Medicaid when they aged out of foster care, if they meet all other Medicaid eligibility criteria, such as being a citizen, immigrant status, and Texas residency. Recipients from the age of 18 to 21 years of age, unless they are in extended DFPS conservatorship, have the choice to stay in Star Health, which is the Superior Health Plan, the Superior Network, and they also have a choice of the Star Program or Star Kids. And then at age 21, they must choose between a Star or Star Plus plan, which we'll get into a little bit more here in the next couple of slides as well. So there is a health plan coverage. So for former foster care children recipients, they will automatically join Star Health through the month of their 21st birthday. Then Star Health provides a full range of Medicaid covered medical and behavioral health services for DFPS clients. Recipients can opt out of Star Health for the Star or the Star Kids program, depending on the situation. This option allows for a choice of health plans because remember, in Star Health, you only have the option of the Superior Health Plan Network. Rather, making the choice of moving into Star or Star Kids, there is a choice of other plans, which we will get to the managed care service map here in the next few slides. Now, once a former foster care child recipient reaches the age of 21, coverage will transfer from Star to Star Plus. These programs provide a full range of Medicaid coverage services for many children and adults. And here's the map that I've been mentioning. So this is your managed care service areas across the state. I will make sure that Cassandra also has this map to share with everyone with that resource email that she's going to be sending. But I do just want to point out that down here in this box is where your Star Health information is found, and Star Health again is statewide, and Superior Network is the only plan that is under Star Health. And then your dental plan, your dental managed care plan, that is a statewide service, and there are 3 dental plans across the state, which are your DentaQuest, MCNA, and United Healthcare Dental. And then you just need to find your area within the map, and it tells you what your Star plans are within your area, your Star Plus, your Star Kids, and CHIP. Every area has their own different ones. Now, if there are any changes, right, we seldomly come across into changes that we need to make to our services. So a youth that has aged out of care must report the following changes to keep their Medicaid benefits active. So for example, if the youth has moved out of state, there's an address change, or there's an enrollment in a health insurance, I do want to point out that benefits received through Star Health Medicaid program, those we cannot make any changes through the yourtexasbenefits.com website. They are not available to use those services. This population of Star Health Medicaid services have to go through DFPS for any address or demographic case changes. Now, if formerly foster care children clients, they can report any changes online through the yourtexasbenefits.com website. So if there are any demographic case changes that need to be done, former foster care children clients can go through the website. You can also make these demographic changes by calling or visiting your local eligibility office. They can also be done in writing by mail or fax, such as completing the Form H-1019 to report those changes, or simply by calling 211 option 2 to make those demographic changes to your case. Now, one of the last things that I do want to show here for everybody today is that it is very important to know that as a Medicaid client, you will receive a Medicaid member ID card, which is called the Your Texas Benefits Medicaid card. If you are under the Superior Health Plan Network, your child will receive a Star Health Program card, and Star Health will be on that Medicaid ID card. So it's very important to note that you want to make sure that once you receive this plastic card, you want to take it with you anywhere you go. Every time that you go to the Medicaid doctor, the dentist, to pick up medicine at the pharmacy, you will need to make sure that you have this card with you, because once you present this card to the doctor, dentist, or pharmacy, they will be able to use the facts on this card to make sure that your child is covered by Medicaid. Now, there is a number on the back of the card that says if you need help, call that 1-800 number 252-8263. It is also important to note that if you're needing to find any additional information on your Medicaid services, you can also access your case, depending on the case that you have, through the yourtexasbenefits.com website. You can also get any additional information by calling 1-855-827-3748. I'll make sure that you have that number too, Cassandra. And again, it is very, very important just to carry that card with you. Even if you're not going to the dentist or the doctor or the pharmacy, just have it with you at all times, because you never know. In case of any emergency, we need to make sure that our children receive the care that they need. And that is all the information that I have today on this Texas Health Steps overview on foster care. On the screen, you do have our Texas Health Steps toll-free line, which is available for you Monday through Friday from 8 a.m. to 6 p.m. Central Time, which is the 1877 number. You have my direct cell phone number on the screen as well, along with my email. And then we also like to share our events website, because our enrollment broker outreach staff are out in the community, like I said earlier, right? Having all that fun at these events, these health fairs, presentations. And we do like to share that out there as well, that these events that we attend as enrollment broker staff, we do set them up on the txmedicaidevents.com website, where you can go and see all of the events happening across the state where our outreach staff will be attending.